Yeah, certainly. So we're doing work today with Army MedCom, and we're seeing a lot of collaboration across the regions. Rather than spending time aggregating data, the time is being spent actually analyzing the information using our technology. And we're seeing really analytics is really changing the way in which healthcare is being delivered and improving patient care. So a great example of this is Children's Hospital of Atlanta, where they have when babies are premature, for anyone that has had a premature baby, they're probably aware of this, but the retina doesn't fully develop because the way in which the retina develops has to have the right level of oxygen and the right level of light, and that is only in the mother's womb in which the retina can fully develop. And so CHOA, as all children's hospitals do, perform a procedure on babies in the NICU. It's a very quick procedure. It's easy to perform. However, the baby is in distress as a result of this procedure because they're opening up the baby's eye, and there's things in the baby's eye at a very early age. And so up until recently, vitals are usually dumped after a couple of days because they're simply too large to store. And so as a result, the way that this procedure was performed is the doctor would look at the baby, they would perform the procedure, a nurse would look at them, say, baby's no longer in distress, and move on. But CHOA has started collecting this vital information and then analyzing it. So they now have a Hadoop cluster which can hold this data, this massive amount of data, and a Qlik analytics engine on top of it. And they were able to determine that the baby's actually in distress for 27 minutes post-operatively.
Oh, wow.
And yet they were moving past the baby after about 6 minutes because the procedure took 4, and they'd stay around for a couple of minutes. So they've really changed the way in which they're handling this procedure, and they now have a nurse stay back with the child as the ophthalmologist is performing the procedure. Yeah. So a really interesting way of improving patient care.
Moment.